Good morning. Thank you for joining Forge Breast Cancer Survivor Center this morning for our coffee conversation. This morning we have Dr. Nate Brooks with us. We're so excited to have him here to kind of talk about spirituality and cancer care. And we would love to, kind of ask some just questions to help in this process to kind of understand some things. As we all know, spirituality and adversity can be very difficult to navigate together and parallel to one another. And so we're really excited for you to talk to us about that and give us some insight. So before we get started with the topic, Dr. Brooks, could you tell us about yourself for those who might be a little bit unfamiliar before we start the topic?
Yeah, sure. Just to make sure everybody can hear me. I'm a
Mhm.
native of Baltimore, Maryland. Came down here to the great South of Birmingham 7 years ago. I've been pastoring here in Birmingham for 7 years. I'm a coach. I'm an entrepreneur. I am the CEO and president of the Change It Foundation, which deal with lives and help people understand the various stages of change, as well as working with nonprofits. Currently, I'm also a chaplain at UAB who deals with a lot of acute care, the highest acuity units at UAB. Those were my units while I've been studying there. I work with the oncologists. I work with the O'Neill Comprehensive Cancer Center extensively. So I kind of understand and know the dynamics that surrounds cancer care, spirituality, also dealing with caretakers and cancer survivors and current cancer patients. Cancer can be ongoing, not just physically, but as well as mentally, not just for the person, but also for the families and caretakers involved. So that's my day to day. Outside of that, I like watching sports. War Eagle.
Oh, that's unfortunate. No, it is Roll Tide. I'm so sorry to hear you say that. But yes, I love that you mentioned that cancer is ongoing. I was talking with Lauren yesterday, and um, you know, she was talking with some survivors over the weekend, and they mentioned about, how unfortunately some people think the bell is the end of the journey, and it is not. Even if your diagnosis isn't, hey, I'm going to be dealing with, treatment for the rest of my life. You're going to be dealing with breast cancer for the rest of your life, just from the changes that you've been through, the new body, the new mindset, all of the things, all of the side effects of the diagnosis. So I love that you mentioned that, because I think that oftentimes gets overlooked by the common, population. It's like, you rang the bell, you're good now. Let's go and get drinks or whatever. But that's not how it works. There's so many other side effects to cancer. Um, and so I know you mentioned that you are a chaplain, and you work with all of these different organizations to support individuals who are going through cancer, and specifically breast cancer as well. So could you kind of tell us a little bit more about how chaplains support patients and families who are dealing with a cancer diagnosis? Can't hear you because you muted.
Listen, I thank you so much. So cancer
Mhm.
diagnosis can be a little traumatic for a lot of individuals. It comes with a lot of anxiety. It comes with a lot of what ifs. It comes with a lot. It could come with early stages of grief. It comes with so much. And so when a patient or care recipient comes and the doctor, oncologist, and their care team comes with a diagnosis, many things run through their head. What I found to be true is that treatments are involved, depends on the stages and what type of cancer it is. So let's just take breast cancer, which affects many women, specifically um, here in this state. And so when a cancer diagnosis comes, spirituality takes a part of that, because they want to know, let's take the spiritual distress piece. And so the spiritual distress piece means, God, why is this happening to me? Why now? What did I do? I've lived right. I have children, not right now in my life. All of these list of questions, what can I do to get out of this? The shock comes. And that's natural, the shock. And the shock waves is just not felt through the lady or the woman. It's felt through the kids, through the families, through the care recipients, and everybody's in shock, because the question becomes, what if? And then you have those dire conversations that take place in your head, and also with many people. Will I be able to survive this? Will I get through this? The big question is, what stage is this? What's next? And so as you go, what I found out is that as care recipients go with their team, their medical team, they want to know, what can we do quickly? Can this be done quickly? And so you have radiation, you have chemo, you have so many things coming at you. And we do want to know, what does God has to say about this? How can I inform myself spiritually? How can I get through this? And many patients want to know, will you be there to hold my hand? Will you be able to answer my questions? I need someone to talk to. And that's where the spiritual side come in. Now, when you talk about spirituality, you're not just specifically talking about religion. You're talking about those things that informs the person on their day-to-day basis. How can I get through this? What do you have to help me? How can I meditate? What should I be praying about? What can I talk to God about? How can I talk to my family? So all of these things come into play. And as a chaplain and as a spiritual caretaker, I'm there to support and help, and also help them through their distress, whether it be spiritual distress, anxiety, and other things that may come up in the person's life and whatever they're going through.
I think that you hit like a key component. And oftentimes when we think about spirituality, some people immediately associate it with religion, even though it's not technically the same thing, but there is a connectedness. You know, spirituality is connectedness and wholeness, purpose for being. And sometimes when you're going through adversity, it can feel like, what is my purpose if this is what I'm going through and this is my adversity? You know, why am I going through this if my connectedness and my spirituality isn't aligned with what's happening in my life right now? People who are kind of going through that kind of mindset, naturally so, right? We oftentimes might have things that happen in our life. We're like, but why me? I just went to church on Sunday and I paid my tithes. Like, why am I getting this diagnosis this week? Or why is this happening to me? For individuals who are in that state where they're stuck in the whys, spiritually, what type of thoughts and advice might you give individuals who are having a difficult time navigating through like that why phase? Like, why is this happening to me?
Yes.
What have I done to cause it to happen to me? Because it can, even though realistically we know nobody does anything to deserve cancer, but it's kind of hard to get your brain out of that space, right? Because we want to take all this accountability for the things that happens to us.
Yeah. So first, with me, I like to help the person cope and normalize their experience. Oftentimes, a lot of care recipients and our patients, they say, well, is this normal? And they ask the very, very real, normal questions. And I want to say, yes, your question is real. And I want to help you cope with it. I want to be able to normalize your experience and help you understand that you're not alone in this, and that you're amongst many. And I know that that is not as calming, but it helps calm the person a little to figure out their purpose, to be able to say, from here, how do I live forward and not try to live backwards, and also stay in the moment with the patient. One of the things that I like to do is stay in the here and now with the patient. What are you dealing with now? How are you feeling? Let's gather your feelings. Let's be in tune with how you're actually feeling. Let's be in tune with what are you feeling about this diagnosis. That helps the patient cope. That helps the person feel real. That lets them know that you're here with them. There are a lot of factors that are involved with a diagnosis that happen in the background. Yes, you get the initial shock, you get the tears, you get a lot of fears, but so much else is going on. And that's when your spirituality, that health comes, that spiritual moment comes in. It's not a religious moment, it's a spiritual moment. It helps them understand, how can they talk forward with their families. It helps them understand that a plan is needed, a plan for you to for us to be one-on-one with your medical team and your medical treatments. It helps us help you align with your purpose going forward. And a lot of people don't know what is their purpose after a cancer diagnosis. And I want to say, the purpose is not death all the time. Death, you may see it or you may feel it, but it's so much more to live for, and to live in those moments, and to help our loved ones go through this experience together. And I think that's where the spirituality comes from. So this is the greatest moment when you can bring a patient and their care team, their medical team into one accord. So therefore they can feel like they have a circle of survivorship, even while they're going through it. They have a circle of people that don't mind being there with them, walking through it with them, and it helps them cope much better.
And so, in saying that, what are some ways that chaplains and medical staff kind of integrate to holistically help this patient through a cancer diagnosis or breast cancer
Yes. So
diagnosis?
what is the next steps? What are the next stages to this? How can we be successful in understanding your treatments? And that comes with the patient. The patient will have to be able to say, I want chemo. I want to be able to take radiation. How long? What does it feel like? What does it look like? Being able to be a communicator between the physician and the patient, because physicians oftentimes can say things really quick, really fast. They're in the moment. They've gone through this several times. And we know when a person is in shock or they just don't in disbelief, they don't hear half of the things that the doctors are saying. They don't know. Their mind is spinning. So it helps. So one thing is being able to communicate, what is your next plan? What are your goals of care? So I want to put that word out there. What are the goals of care that have been outlined by your team? And are you in line with the goals of care? Does this or will this affect you? Will it affect your job? Will it affect your kids? Will you have someone to be able to take you? Will you be able to work with them? And so these are the lines of communications in which chaplains say, hey, let us step in and let us help. Let us get you to breathe in a little easier. Will you be able to, and also, oftentimes, and not so many other times, but let's connect to another dot. There may be pre-existing conditions that a patient may have in addition to breast cancer or some type of cancer diagnosis. So now you have compounded issues. I'm going through this, and now I'm going through that. How in the world do I function? And so we want to be able to relate with the person and be able to say, hey, let's function forward. Let's work forward through this. And we become a calming presence in a very anxiety-filled way, journey for a patient, because let's be honest, cancer diagnosis brings anxieties here. So we want to make sure that they have enough tools in their toolbox to function within that anxiety, to work within that anxiety, as well as work with the person to understand and achieve purpose in their goals of care.
And so, like, what are some things like, so when a person has been diagnosed and they're kind of going through the motions, whatever that looks like, it looks different for everyone. But for those who do have a sense of spirituality and recognize that, and they're kind of just going through, like I was mentioning earlier, just the why phases and how do I maintain a positive outlook on my spirituality or my relationship with my religion or whatever that is. What are some of the things that you've seen working with breast cancer patients, working with cancer patients in these settings, that seems to be the hardest thing for them to kind of break through that barrier and start on the next steps as they matriculate through their journey, and kind of look forward to seeing the other side of it. How do they get through?
Yes. So
What is the glass, if that makes sense?
what is the moment that's hard to get through is very clear that whenever a person is diagnosed with cancer, they see death.
Mm-hmm.
They see instant death. They're at the moment of death. They're at the moment of their demise. And helping them understand that they're not there yet. And there's so much that they can do to get through. Going back to what are the goals of care? What is the treatment that your doctor is prescribing or asking you to go through, right? Because they can't tell you, they can only ask you, and you have to agree. And so moving them through that thin thread, and being able for them to see a light somewhere in this dark tunnel, right? They have to be able to get to see the light. So what I've learned is always include people that is close to them, because you have to have someone that can help them see the light. What are they living for? What are your purpose? What are the good attributes about you? Let's not focus on this one hard thing that's in the room. And we can, it's okay to keep that thing in the room, right? Because you can't remove that big elephant in the room, but you can definitely talk about some of those great things that are allowing the person to live forward. So what I've learned to do is listen, being able to listen, the power of listening, the power of being an active presence, a listening presence, a calming presence, a very reasonable presence. What you don't want to do is lie to a person, and what you don't want to do is give them false hopes. You want to be able to stay real with them in the moment and articulate what are the goals of care. You don't want to hide anything from them. You don't want to sugarcoat, because you know that leads to just a snowball effect. So you want to make sure that the person understands the realness of the issue at hand, but also understand that there can be lights at the end of the tunnel, right? There can be lights. Let's start with your treatments. Let's say that. Are you willing to start with your treatments? And being able to, and then the second one is getting their hard questions answered, right? Because I'm not in the medical oncology field, but I do help facilitate. What are the hard questions that you have? Let's get these out. A lot of times that's being that patient advocate as a chaplain as well. So I have to be that patient advocate to be able to say, hey, they have hard questions that they're afraid to ask. Let's get these hard questions in the room. Let's get them actively answered. And let's get those questions that can't be answered right now. Let's get them on the table. What that does with a care recipient or a patient is allow them to see, hey, somebody is listening. I have somebody in my corner. I was afraid to ask that. Here's another question that a lot. How much medicine will I have to take? Will that affect my mental? Will that affect my physicality as a lady, as a woman? You know, you want to love your body, and we want you to love your body, and I want you to be able to love your body past being diagnosed with breast cancer, because we know that women, they love their physique, and so they want body positivity. Will this affect me? Let's go a little deeper, Janida. Will this affect me and my husband? Will this affect relationship? Will this affect relationship with how I see myself in the mirror? What's next? So all these questions come into the room. As chaplain, as spiritual guider or guidance, I would have to be able to have those conversations of trust. So number one, listening, bringing the real answers in, build trust, and let's continue to work through these goals of care as quickly and as small as possible. It doesn't happen overnight, but it can happen in a moment, right?
Mhm. I've never heard anybody mention the connection between a chaplain and a patient advocate. So I appreciate that, because oftentimes when you hear the word chaplain, you just think about, prayer and all of the things that come with association to religion. So I never thought about it in that aspect. So I appreciate you kind of making that connection for us today. So if somebody wanted to explore this option as they're navigating through their diagnosis, who do they turn to say, hey, I want to talk to a chaplain? And what are some things that you would like for patients to know prior to seeking a chaplain? Because again, some people might have a sense of spirituality, but they're not necessarily religion. So chaplain might be kind of an off-putting word for those individuals.
Mhm.
So what are some recommendations do you have for individuals who kind of want to seek out this service to address their spirituality alongside their treatment while they're going through their journey?
So yes, so at UAB, you can request a chaplain with 24 hours there. Is someone always on staff at UAB. Now, when it comes to personal care and breast cancer survivors or those that's still going through the journey, I would like organizations to maybe let's have a chaplain stand by. Let's have a chaplain on call. Let's and so many organizations should have that spiritual side on call, or someone that can step in to help and do regular meetings with cancer survivors and those that are going through the journey. At many hospitals, specifically here in UAB, within the Birmingham metro area, chaplains are part of the hospital. And really and truly, a lot of the larger hospitals in the United States, chaplains are there, but specifically in UAB, we take it very seriously. So a lot of people don't know we are patient advocates. So we function as the advocate between the patient and communication with the doctor. Bedside manners is one of the things that I am so big on. When the doctor rushes in, give you this moment of gasp, we have detected some type of cancer in your system, more test is needed, however they put it. I want the doctors to be gentle. I want them to be in the moment. I want them to be accurate. I want them to be able to address the concerns right there in the moment. And I want them to be able to hold the moment dearly to them and not hold the patient as just another number I have to get through today. And so when I see that happening, I immediately step in and say, hey, how can we, let's talk about this. Let's get this person's care recipients in the room. Let's do a goals of care meeting, right? Let's sit down, give this person a moment, because what you did is just knock them off their feet. How can we get in contact with you again? Does the CNRP, the certified nurse practitioner, know when you put it in your notes, how can we get a hold of you? So I want all of this available to the patient, because it's not the doctor that's the concern now, it's the patient at all times. It's the breast cancer person, it's the diagnosis that's in the room. And so that's one part of advocate, as well as being able to advocate for those hard moments that a person have. Oftentimes, they don't know what to ask. They don't know how to ask. In fact, they don't know where to begin. And so I help walk them through at the beginning. Did you hear what they said? Ask about the stage. What's next? Ask the critical questions. When will I be able to begin? Will this interact with my other pre-existing conditions? Tell them up front, I have asthma. Do they know everything? Because here's the thing, we don't want to take for granted, and I know this may sting a little bit, but we don't want to take for granted that everyone that comes into the hospital knows their medical history, right? Let's take for granted. Sometimes people go into the hospital for the first time, first diagnosis, haven't had physical treatments regularly, don't have a normal care provider, or they haven't been in years. They didn't know they had high blood pressure. They've been functioning with all of this around them. What's there? And here's another, what's your sexual health like? Have you gotten a pap smear? Do you know how to do a mammogram? Do you know how to what's there? These are personal questions that must be asked, must be talked about, and must be brought to the table. And that care team and that physician staff must be willing to say, I'm here with you, and we're going to walk through this with you.
Well, thank you so much, Dr. Brooks, for joining us. And thank you so much for the insight. Like I said, one of my high takeaways from this has been just the connection between chaplain and being a patient advocate. And I'm glad to know that it is available. One of the chat members said she didn't know it existed at UAB, and I did not either. Just because of the connection that we make between chaplain and religion, right? And UAB is not a religious hospital. And so, naturally, you would just assume that I need to find a social worker or something. So it's really nice to know that, chaplains are available at major hospitals for individuals to take advantage of. And thank you for being there to assist these individuals as they navigate through their diagnosis.
Yes. So during the intake process at UAB, they asked, will you want to talk to a chaplain? They always ask that. Or do you want, depending on the stage of the cancer or the stage of the diagnosis, we are the ones who provide advanced directives. If a patient becomes ill or can't speak for themselves, what is the next level you want to take? So a chaplain immediately have to get involved with the advanced directives. We're the only ones that can do it. And so advanced directives are part of your planning for your life. All right, that's your right here in the state of Alabama.
Well, thank you so much, Dr. Brooks. It's been a joy to have you. And, again, thank you so much for being there to support breast cancer patients, all cancer patients as they navigate something so hard as breast cancer, so hard as cancer, knowing that the journey is elongated. It doesn't stop after you ring a bell. It doesn't stop after you've, had your annual checkup. There's always just something that kind of changes about your life that you're not your pre-cancer self, and you'll never be your pre-cancer self. And so recognizing that there's a spiritual component to it, and having that resource available is so important. So thank you.
Thank you.